Hi, Joanne. How are you?
Hi, how are you?
Good. Thank you so much for joining us for Conversations in Care, which is Jackson Health Foundation's webinar series to really help educate our donors and others in the community about the great work that's being done philanthropically, but also give them updates about what's happening at Jackson Health System and at Holtz Children's Hospital in this case in particular. So thank you.
Happy to be here. Thank you for having me.
Tell me a little bit about your new role, since you've recently, and when I say recently, I know that's relative, right? Because when you work at a healthcare system, you just kind of hit the ground running. But tell me about your role. I know you came on as our Chief Nursing Officer for Holtz, but that very quickly transitioned.
It did. So I was the Chief Nursing Officer for probably 5 to 6 months. And then I moved into the Chief Executive Officer and Senior Vice President role officially in February of this year. And so in that time, just really integrating into the health system and all things surrounding the role. In that role, I just really see myself as the person who is ultimately responsible for the operations of the hospital, making sure the hospital is really running in a way that supports the patient outcomes that we need. And so if I had to summarize my role in one word, it would really be the facilitator of healthcare at our hospital, just looking at the entire hospital from the women and the children's side.
And in the amount of time that you've been here, have you been able to assess what do you think makes Holtz Children's Hospital so special and unique?
Oh my goodness. One of the great things about being on the newer side, I feel like I can't use the word new anymore. I was warned about that actually today, is that you really have the opportunity to look at greatness and recognize it because it just is not the everyday common thing. And so coming into Holtz and seeing the level of care and compassion over taking care of these children who at times are so critical is unlike anything I've ever seen in my career. The love that our practitioners, whether it's nurses, doctors, social workers, or child life specialists have for our patients, I really have never seen it anywhere. And I think that, when you look at some of the outcomes in the work that we do, you cannot separate that from the dedication of the team who's taking care of them.
That's fantastic. That's so amazing. Give me a little bit of background on Holtz and share it with our viewers as to, how long have we been around? What makes us a standout? I know we have one of the largest NICUs in South Florida, so give us a little bit of background.
Yeah, so our hospital officially opened in 1983. Was the first time that the hospital opened, and then renamed in 1998 after a gift from the Holtz family, which is where we gain our name from. But this hospital really has every subspecialty care possible for our children. And so whether it's on our oncology unit, whether it's on one of our burn specialty units, our transplant unit, our critical care unit, and then ultimately also our NICU, we are able to provide care from the minute a child is born all the way through their adult years, which is really a unique experience because at the Holtz Children's Hospital, you have every single specialty, and therefore a child will never have to get transferred out of the hospital to receive their care anywhere else, which obviously reduces transitions, reduces handoffs, and ultimately leads to better outcomes. And I think that is really one of the key components of our services and why we have the outcomes that we do that we're able to brag about at the Holtz Children's Hospital.
Well, I often hear the phrase that at Holtz we serve the sickest of the sickest. What does that mean?
It is so true. And I think the special part about that is we serve the sickest of the sickest, but we also are able to serve those who really just need to come in, need to feel better and go home. But when we say the sickest of the sickest, Holtz Children's Hospital really excels at that quaternary care, which means we have a child, one of the things that we are recently celebrating is a child who was really given no chance of life. And was transferred to our hospital from another organization. And the dedication from our physician team, just not to give up and look at the possibilities for this child, even doing a procedure that is the first time it's ever been done in the country for this child, and then to see this child leave, discharged home, and is recovering with their mom at home is nothing less of a miracle. And that really is the complexity that you see at the Holtz Children's Hospital. And when you walk through our ICU, you walk through some of our units, that is what you will see. But you will also see just the hope that they have knowing that they can get the care that they need here.
And recently, Jackson Health System has expanded their pediatric services across the county. Tell me a little bit about that.
Yeah, we actually now have emergency rooms at our Jackson South, Jackson North, Jackson West hospital, and that really allows us to deliver care where the child needs it most. And so we know that during those emergencies, no one wants to travel across Miami to get to an emergency room. And having pediatric certified physicians at every single one of those emergency rooms allows us to provide that emergency care that the child needs right in their own backyard. And in the case that the child does need an admission, we have a 24-hour transport team that is able to bring the child to Holtz and get the care that they need at Holtz. But it really has been transformative in us being able to expand our tentacles out into the community and giving a service that was so needed in some of these areas, no longer making that child travel long distance from their home.
The NICU at Holtz Children's Hospital is considered one of the largest in the nation, but it's also one of the best. So I'd love to hear from you as to why you think that is.
Yeah. Again, I'm going to always start with the amazing people that we have caring for our patients there. But our unique ability to be able to manage anything that comes into our NICU in one place, again, I go back to what we said about pediatrics, really is unique to the Holtz Children's Hospital. If you can imagine at birth a child weighing less than 1 pound, and the amount of expertise and technicality that is needed to keep that child infection-free, to keep them stimulated at the right level, not over, not understimulated, and the amount of dedication that goes into that doesn't happen by accident. It happens by very precise care by a team who needs the right technology, who needs the right resources, and then ultimately the right clinicians to provide that level of care. And the NICU is constantly, creating new methods to ensure that our patient outcomes are strongly connected to our family and patient experience. Very recently, we are starting the journey to open up a milk bank in our NICU. And with that, we are also providing the ability for a mom who might be at home who really has this desire to breastfeed their child. We are going to be providing them with the technology to be able to log into their patient's bedside, be able to see their baby while they're pumping, and right at home be able to download the amount that they pumped and then bring it to our milk bank. It's really a technology that is going to help us promote more breastfeeding with our neonatal population, but also help with that maternal connection to a child that they don't have at home and has to spend time with us. So when I look at the NICU in totality, being able to continue as innovations continue to grow, how we evolve with that as a healthcare team is really important, and then how we make sure that we keep the family connectedness at the center of all that we do is going to be really important. Ultimately, mom's going to take this baby home, right? So we need them to be connected from that perspective.
And I'm so pleased to say that the foundation was able to partner with a donor to make that program a possibility for us to be able to offer that in the NICU. So philanthropic partnerships are very important because they make programs like this happen.
Yes.
And I know we have another philanthropic partnership that we'd love to talk about that just transpired a few months ago. So tell us a little bit about the Shriners and how we're partnering with them.
Yeah, so we are actually able now, as you said, going into a partnership with Shriners, and that's going to really expand our ability to provide that orthopedic support for patients in the pediatric department that otherwise is not there at this current state. And it's an area that we've known we wanted to expand, we've needed to expand, but that's why really having that philanthropic support is so important, because without it we can't continue to grow and expand in this way. And our partnership with Shriners is going to bring a pediatric orthopedic center into the Miami-Dade County that is going to be so specialized to really manage the orthopedic needs of our patients. So we're really looking forward to this. When we think about all of the abnormalities sometimes that we are dealing with at birth, being able to provide that support with our Shriners partners is really going to change the outcomes of our patients in this area. And again, going back to what we talked about from the emergency department, our patients will have it in their backyard. When we talk about healthcare, you hear access, access, access. And these gifts are really allowing us to close the gaps in access. And that's really what we look forward to in these partnerships.
So part of these philanthropic gifts combined with the plans of the health system, there's a bigger future planned for Holtz. What does that future look like? I know there's some interesting projects in the works.
There are. We are most excited about our pediatric emergency department coming up. It is a project that has long been in the plans, and there's a little pandemic that got in our way. But this pediatric emergency room, even in the design of it, we are talking about from the moment a patient walks into that emergency room, how are we creating an environment that helps to promote healing? When we talk about outcomes, when we talk about being able to have patients get better, our environment and our ability to be able to create that environment to support that is so important. So we're going currently from a 9-bed emergency department to a 24-bed emergency department. Our team is like counting down the days for that. We are creating an autistic-friendly area in that room. We're creating spaces that are safe for our patients who are struggling with any mental health comorbidities, brand new state-of-the-art resuscitation rooms in that area, and just looking at the entire environment, how we create spaces that while the child is getting their care, they can also collaborate with a child life specialist. So the detail that's going into that is probably the most exciting, because we have the ability to create this environment right now for the way we want it to serve us in the future.
And from an outpatient perspective, we're also looking at having a pediatric outpatient pavilion. Yeah. That's equally as exciting. Tell us some about that. That's part of the partnership with the Shriners, where the orthopedic clinic will be housed, but what else will be housed there?
Yeah. I don't like to put any project in the order of favorites or what I'm looking most forward to, so I'm not going to do that, but man, I'm looking forward to that project. And that is really going to, imagine having a sick child and you have to go to the cardiologist, in one location, and then getting that child in the car and then taking them to maybe a rheumatologist or a neurologist. And then imagine being a mom who is just barely at the poverty level trying to do all that, having to miss work, having to come back and forth to a doctor to take care of a child that she's really trying to do her best at. Being able to have this pediatric outpatient pavilion places all our specialty, all our primary care in one location, and also allows us to offer any ancillary support around radiology, blood draws, any infusion support that we can do. So, if we just trace the life of a mom in today's society, or a dad, or a parent, or whoever that caretaker is, and we think about how can we help our population really meet us where they need to be to give their child the best care, this pediatric pavilion is exactly what we need to be thinking about. True integrated care in one location where a parent just has to hit the elevator to go from one appointment to the other.
I remember my kids being young and having 3 of them under the age of 5. Yeah. And when you had to take one to the emergency room or to doctor's visits, how chaotic that was when you had to go back and forth. So I can only imagine how grateful parents will be to have the ability to do that in a much more seamless way, and saving them so much more time and aggravation as they're dealing with the kids while they're trying to maneuver the campus and all of that. So I think that's all going to be a great thing, and I'm too looking forward to it. I don't think I can say I have favorite projects either, but this is definitely one that I think you and I are both really hoping to see come to fruition very quickly.
Absolutely. It's a true need in our community if we really want to get ahead of the access of care issues. Being able to make that easier for parents to access and to navigate is really a responsibility on our end.
How can someone, the average person in the community who may be willing to want to donate their time or their treasure, support Holtz?
Wow, so many ways. I mean, certainly, we are always looking for people to help donate any of their time. And for anyone, we really depend on our foundation to help us to navigate anyone who's looking to donate to our efforts. What I will say to that end is that every little piece that you can donate, whether it's your time or your treasures, is so appreciated on our end to help us navigate some of these projects that we really know need to happen. You know, volunteering at Holtz is always a priority for us as well. We have a volunteer department that will help us navigate that. And sometimes that's as simple, you know, last week I was having a conversation with someone about even being able to help parents get home, right, when they don't have the ability to get home after they delivered. But then sometimes it's coming in and holding a child who may be suffering from symptoms of withdrawal. Sometimes it's just reading a book to a group of children in our PPEC that we were able to do this week. You know, there's so many ways to get involved, and certainly, you know, from being able to make any gift with treasures, we depend on our foundation to help us navigate that.
Well, recently I learned, which is something that I didn't know, so because we are the public health system, we do get many patients that come here that are of low means or uninsured, and we don't turn anyone away because of who we are. That's what Jackson stands for. And I learned that when a baby is discharged, they need to have a car seat.
Yes.
And if the parents cannot afford a car seat, we provide one to them. So just recently, we were working with our team in the office trying to identify how we could get car seats donated. So sometimes it's something that simple that the average person wouldn't think of, but we really are thinking of the whole experience for the parents and the family. So someone wanting to support that way to creating a milk bank or naming a wing, right? There's all different ways for individuals to support and get behind our pediatric services here at Holtz. And, you know, we appreciate all of them
Absolutely.
equally.
Absolutely. You know, I think along the lines of the car seat, we also have parents who are discharging home, and, you know, we're doing a lot of education around safe sleep, but they can't afford a crib. Right? And so how do we help them get a bassinet, get a playpen in their area so that their child can have a safe space to sleep? And those are just, sometimes we don't really understand the impact that those smaller gifts can have, but all of that goes a long way in promoting the health of our patients, for sure.
In your role as CEO of Holtz, you also oversee the Women's Hospital at Jackson Memorial Hospital. Tell us a little bit about that.
The Women's Hospital is just such an amazing place. I mean, the evolution of just the care that we provide there has been way before my time, but I'm certainly so happy to come along this journey. And, you know, from our maternity services that we offer a full complement of maternity services. But very important is that we also offer the highest level of maternal fetal medicine and high-risk care for our moms in this county. It's very important to be able to have a system in place that walks a mom through whatever situation she's in her pregnancy. No two pregnancies are alike.
Right.
Any mom who's been pregnant more than once knows that. And it's important that we are able to meet a mom where she is along her journey. And our Women's Hospital does that, and they do a phenomenal job at it. We currently have over 4,000 deliveries a year. Yeah, we talked about our NICU a little bit, and we have a full service of gynecology, oncology for women, a full antepartum service, and anything that a woman needs for her care at the Women's Hospital.
So I know that we recently have hired a fetal surgeon, and I know the importance of that, but I'd rather you explain that since you know the technical terms a bit better than I do. But how impactful is that?
So impactful for our hospital. You know, to have a fetal surgeon in our hospital, when we think about a mom who otherwise would have a complication that would truly threaten the gestation of her pregnancy, so really threatens her ability to go to full term. And we know that the younger babies are, that, you know, the more complications they will have. And our fetal surgeon and the procedures that he does enables us to really go in during pregnancy, fix certain anomalies that may be present or certain situations that may be going on, and allow the mom to retain that pregnancy and to continue on in utero, which is the greatest development place for a child to be. There is, you know, we do a great job at mimicking the womb in the NICU, but there is no better place for that child than to be in that mother's womb for the duration of that pregnancy. And having a fetal surgeon allows us to do procedures that, again, in another center, this mom would probably go into preterm labor, or they'd have to induce the preterm labor because of the dangers to the fetus. That doesn't happen at Jackson now with the introduction of our new fetal surgeon. A couple weeks ago, he was doing a procedure, and we were actually able to get some pictures of the procedure, and you just saw this tiny little hand through the sac, and you could see the hand so clearly, almost like they were waving at us, during that procedure. And just to think that that mom will leave the OR and go on to be pregnant for another 10 weeks, it's a miracle. It's just a miracle what we're able to do.
The advances in medicine and the fact that we're able to offer that here, it's just must be so comforting to so many of these, new mommies. So
yeah, it's amazing.
It's pretty amazing.
It's in our backyard, so.
Well, I want to thank you for joining us today and really providing some insight, not only on Holtz and our NICU and with our little babies, but also for the Women's Hospital, and talking a little bit about how philanthropy has made an impact for Holtz, and we hope that it continues to make an impact for Holtz. And for those individuals that want to get involved, they can either reach out to the foundation, they can go to our website, jacksonhealthfoundation.org, or they can contact us at 305-585-GIVE. Any way that someone wants to help, whether that be through a donation or through giving us their time, we certainly appreciate that. But this is the community's hospital, right? So we really always reach out to the community and hope that they will be there, because Jackson and Holtz is always there for them. So we oftentimes hope that they will be there for us when we need them. But thanks so much, Joanne. I appreciate your time.
Of course. Thank you.